Good morning, wherever you are. This is Sophia Reyes from ConferenceHype. Our segment will focus on interpretable artificial intelligence to predict preoperative risk factors for failure to rescue after coronary artery bypass grafting. From the 2026 May edition of the Journal of Thoracic and Cardiovascular Surgery. Background: failure to rescue is a significant quality indicator for postoperative cardiothoracic care. Methods: adults who underwent isolated CABG in an academic health system from 2011 to 2022 were analyzed. Results: a total of 9,974 patients were identified, and the overall FTR rate was 2.5%. Discussion: this study utilized artificial intelligence algorithms to evaluate and interpret an optimal set of preoperative risk factors for FTR after CABG. From the 2026 July 21 edition of the Journal of Thoracic and Cardiovascular Surgery. Background: to investigate anatomical and clinical factors associated with tracheoplasty in children with pulmonary artery sling and congenital tracheal stenosis. Methods: this retrospective multicenter study included children with pulmonary artery sling who underwent surgical treatment at 3 cardiac centers in China between January 2010 and September 2025. Results: after excluding 24 patients with incomplete preoperative imaging data, 330 patients with pulmonary artery sling and congenital tracheal stenosis were included. Discussion: younger age, long segment tracheal stenosis, and more severe airway narrowing were independently associated with tracheoplasty in this multicenter cohort. From the 2026 July edition of the Journal of Thoracic and Cardiovascular Surgery. Background: predicting prolonged intensive care unit length of stay remains challenging, and traditional statistical models often fail to capture a patient's complexities. Methods: adult patients submitted to cardiac surgery were categorized into short or prolonged ICU LOS in the cardiothoracic ICU. Results: prolonged ICU LOS occurred in 48.8% of the 1,387 patients included in the analysis. Discussion: supervised ML models offer a reliable approach for predicting prolonged ICU LOS using perioperative data in patients admitted to a cardiothoracic ICU. From the 2026 June edition of the Journal of Thoracic and Cardiovascular Surgery. Background: laboratory research suggests that vasopressin restores systemic arterial pressure without significantly increasing pulmonary artery pressures, compared with norepinephrine. Methods: our single-center, cluster-randomized multiple crossover trial enrolled patients undergoing elective cardiac surgery who developed systemic hypotension and cardiac index 2L-min-M2. Results: we analyzed 153 patients, 70 assigned to vasopressin and 83 assigned to norepinephrine. Discussion: we found no evidence to support the preferential use of vasopressin over norepinephrine in patients undergoing cardiac surgery.
This is Conference Hype. Stay with us, coverage continues.
From the 2026 May edition of the Journal of Thoracic and Cardiovascular Surgery. Background: neuroprotection during aortic arch surgery often involves hypothermia and the use of adjunctive cerebral perfusion. Methods: registry data from 1,079 patients across 42 centers who underwent elective aortic surgery with HCA between 2018 and 2024 were analyzed. Results: ACP was the most common strategy, followed by RCP and NCP. Discussion: in this large multi-center cohort of patients undergoing elective aortic arch surgery with short HCA times, RCP was associated with a significantly lower risk of postoperative stroke compared to NCP. From the 2026 June edition of the Journal of Thoracic and Cardiovascular Surgery. Background: the internal thoracic artery is the first choice for coronary artery bypass grafting. Methods: human ITA rings were obtained from patients undergoing coronary artery bypass grafting and mounted in a wire myograph. Results: both adipo-RON and A23187 induced concentration-dependent vasorelaxation. Discussion: PVAT exerts potent vasodilatory effects on human ITA, even in the absence of nitric oxide and endothelium. From the 2026 May edition of the Journal of Thoracic and Cardiovascular Surgery. Background: to evaluate characteristics and outcomes of patients bridged to orthotopic heart transplantation with microaxial left ventricular assist device versus durable LVAD. Methods: this was a single-center retrospective cohort study in which characteristics outcomes of patients undergoing orthotopic heart transplantation between May 2019 and May 2024 who were bridged with MILVAD versus LVAD were compared. Results: over the study period, the percentage of patients bridged with MILVAD increased from 0% to 20%. Discussion: the use of MILVAD compared with DLVAD as a bridging strategy was not associated with differences in survival. From the 2026 May edition of the Journal of Thoracic and Cardiovascular Surgery. Background: hybrid ablation for atrial fibrillation consists of a thoracoscopic epicardial ablation followed by an endocardial catheter ablation. Methods: patients with refractory AF underwent HA between the years of 2015 and 2025 at a single institution with a single surgeon. Results: in total, 304 patients were identified who underwent the first stage epicardial ablation, 239 of whom also completed the second stage endocardial ablation between the years of 2015 and 2025. Discussion: in this large single-institution study of hybrid ablation outcomes over a 10-year period, we demonstrate excellent short and long-term freedom from AF with low rates of complication and conversion to open surgery.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 June edition of the Journal of Thoracic and Cardiovascular Surgery. Background: valve-sparing aortic root replacement provides durable outcomes when successful. However, limited data exist on the incidence or consequences of repeated intraoperative repair attempts or failure. Methods: we retrospectively reviewed patients who underwent aortic root replacement between 2002 and 2023, excluding those with aortic stenosis, previous aortic valve replacement, endocarditis, or partial root replacement. Results: VSRR was unsuccessful or required multiple cross-clamp attempts in 9.4% of cases. Discussion: VSRR was technically challenging or unsuccessful in about 10% of cases, especially with advanced. From the 2026 July 21 edition of the Journal of Thoracic and Cardiovascular Surgery. Background: this post-hoc analysis of the posterior left pericardiotomy for the prevention of atrial fibrillation after cardiac surgery trial examined the association between sex and postoperative atrial fibrillation characteristics following cardiac surgery. Methods: in PALACS, patients undergoing cardiac surgery were randomized to posterior left pericardiotomy or no intervention. Results: this analysis stratified participants by sex, evaluating differences in POAF incidence, duration, burden, postoperative in-hospital length of stay, and pericardial effusions. Discussion: in PALACS, female patients had lower adjusted risk of POAF. However, the clinical course of POAF was similar between sexes. From the 2026 May edition of the Journal of Thoracic and Cardiovascular Surgery. Background: to evaluate perioperative and postoperative outcomes associated with commercial three-dimensional reconstruction, modeling for preoperative planning of segmentectomy, and to assess the ability of 3-doctor to predict surgical margins. Methods: patients with clinical stage IA1-2 non-small cell lung cancer who underwent segmentectomy with or without 3-doctor from July 2021 to April 2025 were identified. Results: a total of 266 patients were included. Discussion: the use of 3-doctor for segmentectomy planning was associated with fewer postoperative complications and shorter operative time in the setting of complex basilar segmentectomies. From the 2026 May edition of the Journal of Thoracic and Cardiovascular Surgery. Background: the modified Blalock-Taussig-Thomas shunt is a critical palliative procedure for infants with single ventricle physiology, but thrombosis-related occlusion affects 8% to 12% of infants and carries nearly 50% mortality. Methods: we used patient-specific imaging data to test 54 idealized MBTTS configurations, systematically varying key geometric factors, pulmonary artery diameter, shunt diameter, and insertion angle. Results: we computationally identified optimal geometric configurations. Discussion: results provide a framework for optimizing MBTTS design to reduce thrombosis risk based on hemodynamic risk factors, including actionable recommendations for shunt placement and design.
This is Conference Hype. Stay with us, coverage continues.
That's it for now for Conference Hype's coverage of the May 2026 issue of the Journal of Thoracic and Cardiovascular Surgery. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.